I'm Steve Wolf. I direct the Center on Society and Health at Virginia Commonwealth University. I've been doing research for decades now, but doing work that was funded by PCORI with its emphasis on stakeholder engagement has really been a meaningful change in the quality of the research that we're doing. By engaging patients and other stakeholders in the research process, we are making an active effort to try to address questions that matter to them, measure outcomes that are meaningful to them, and engage them in the process of trying to find solutions. Doing this kind of research has been a transformative experience for me, and I've tried to share that perspective with my colleagues. For years, researchers have lamented the fact that they can't get the community engaged in their research, or they can't get patients engaged in their research. And what I've discovered through this experience is we've got the question 180 degrees backward. We need to get researchers engaged in what communities are doing. We need to find ways to make research relevant to the work that patients do and that communities do to improve their health.
My name is Bill Jakes. I was a participant in a focus group that looked at informed decision making in 3 various areas: breast cancer research, or breast cancer screening, colonoscopies, and prostate cancer screening also. The advisory board was something that I had never done before. I started with a focus group that I thought was going to be a very short-lived focus group. As we got into talking with other people in the focus group, we found out that there was a lot more to be done. So the group expanded, and we worked on this project for 2 years instead of an initial short-term period.
My name is Chanel V. I'm a resident in the Richmond community. I became part of this project because of my involvement with the Engaging Richmond team, which is a community academic research partnership with Virginia Commonwealth University. And this particular project was a stakeholder engagement project. And by being a part of the community, we were the persons who actually helped recruit the participants in our topic groups. I think what is different about the research that we have done is the relationships that we were able to build with the community members that were participants in the project. I believe that their input is different because they had a different type relationship with us, the researchers. They felt more of a friendship with us versus a academic person just asking them questions without having any relationship to them or cares in the world about them. One of the greatest benefits of this process for me has been just the amount of engagement. The fact that the residents who we were actual participants in the project, they're coming up with real questions that they wanted to have answered. The fact that we were able to take them through a process over a period of months where they were able to come in and learn more about a serious medical condition related to hypertension or diabetes, the fact that they were able to learn as well as give us information to help us learn how they felt about it. I've been telling people that this has been the greatest contribution that they could have ever given us. They gave us questions that we're going to use to further the research around the chronic conditions, hypertension and diabetes.
My name is Ming Tai Seal. I'm a senior scientist at the Palo Alto Medical Foundation Research Institute. My project was on improving patient-centered communication, shared decision-making in primary care settings through carefully designed interventions to change behaviors of patients and providers. Okay. So what we did was we know in the literature that researchers have often activated the patients, and it's rarely done that they also targeted the changing clinicians' behavior. So we try to do that by activating both sides of the stethoscope, so to speak. highly, patient-centered intervention that we developed produced very interesting results. Patients tended to report better experience with care. Their providers were more engaged with them in taking into consideration of what are important to them in decision making, and they share that decision making process together.
My name's Dan Doan. I'm on the faculty at UC San Francisco, and we're doing a project on how to better integrate narrative data into health services research and into healthcare decision making. So every day that we make healthcare decisions, we oftentimes turn to stories from our friends or neighbors or family members about what are the choices we have and how to sort through them. Clinicians also work with narrative. They think about their clinical training and their experience with other patients. All those stories are out there. We know they make a big difference, but they don't get into the medical evidence base. So what our project is doing, with help from PCORI, is trying to figure out how can we integrate all of that narrative evidence into the medical database and make sure it's available to policymakers and scientists and consumers.